You know, the precious gift of life is denied to some people. 1 in 7 couples have trouble conceiving a baby. Sometimes the reasons are known. Sometimes it's a mystery. Research is the key to unlocking those mysteries, and a UT scientific team has received a $1.5 million grant to look for answers to male fertility.
There aren't very many sperm here, are there?
Traditionally, infertility problems have been traced to men or women on an equal basis. But in recent years, male infertility has been on the rise. The question is, why?
What step are you at right now?
Dr. John Richburg and his UT scientific team have a $1.5 million grant over 5 years to find some answers and solutions. Richburg is pursuing 2 factors: environmental toxins found in everyday plastic products and the residual damage from chemotherapy in the treatment of testicular cancer.
It's a cancer of young men, and if a young man becomes infertile after the treatment, it's devastating, right? They don't even have a chance to have children.
So, how to beat the cancer but save the fertility?
Well, we certainly don't want to stop chemotherapy because it's not going to be very useful to have a fertile dead person. So we are thinking about ways in which we can protect the testis during the treatment of testicular cancer.
And the team is studying the effects of toxins found in plastics that can cause infertility. The damage is done at 2 vulnerable times: when the male genitalia is developing in the mother's womb and later, during puberty. As their work proceeds, doctors at fertility clinics hope for new solutions. The Austin Fertility and Reproductive Medicine Center has been treating patients for 25 years. They see perhaps 1,000 patients a year. As they wait for new answers, they rely on decades-old treatments, such as in vitro fertilization and artificial insemination. They know their patients are desperate for a cure.
Some men, obviously, would be pretty disappointed and pretty dismayed about it, and I think most men would be. But they take it pretty well most of the time, and they think about where we have to go from here to try and make things happen for them.
Most male infertility problems track back to low sperm count or the motility of the sperm. Causes can be genetic, hormonal, environmental, or a mystery. That's why specialists like Dr. Kavoussi are hoping the scientists can offer new hope.
Yeah, you think about it and you say to yourself, okay, there might be some other things that are cutting edge that might be on the forefront, and there probably are, but I think the research is the cornerstone. You have to have that basis and that foundation from the science standpoint to be able to translate into clinical medicine first.
So, as the doctors and the would-be moms and dads patiently wait, the scientists grind away in the lab, in this case thanks to a federal grant.
You can't do that kind of research without that kind of money and support from the NIH and the public. At the end of this 5-year period, we hope that we'll have some really fantastic insights that then we can start working with some physician colleagues to start to translate this into developments for treatments.